Definitely fact. So we have a lot of treatments, and people worry when they're coming to an orthopedic surgeon that we're just going to recommend joint replacement. So there are times when surgery is necessary. There are a lot of things we can do to help people feel better before we start talking surgery. There are certain medicines that can help arthritis feel better. Now, depending on what other medical issues people have, sometimes people can or can't take those, but there are good medicines called non-steroidal anti-inflammatory medicines. Certain braces can help people feel better. Physical therapy also can play a role in helping people get better. There are multiple injections that we sometimes can use, including steroid shots. There are some lubricating shots called gel shots. There are also newer biologic shots that I've heard sometimes advertised on the radio called PRP injections, and we offer all of those. There is another type of shot out on the market called a stem cell shot, and so there are many different kinds of shots. Depending on the patient and their medical history, and depending on what kind of insurance they have, sometimes all of those are covered or not, and so we kind of have to talk with people about that. If we've gone through all those modalities and we've exhausted all these things and you're still having problems, then there are surgical options. Sometimes we can scope a joint and clean it out. Sometimes we do need to talk about replacement. And I don't think there are things to be feared. Nobody dies of arthritis, so we never have to say you have to have a joint replacement. But kind of a rule of thumb is if you are finding that you can't do the things you want to do and you're adjusting your life based on what you can't do or how to alter what you would normally do, then that's the time to think about coming in and seeing an orthopedic surgeon to find out what options are and how we can help you get back to the life you want to live.